is the most common symptom as we begin to age. So if you notice over here to the left, this is the prevalence of these different urinary symptoms. Now, nocturia on the questionnaire is number 7. That's just the 7th question. But when you actually look at how many men complain of nighttime urination, the prevalence in that age of 40 to 79 is almost as high as 50%. So nighttime urination is the predominant symptom that men experience as we age. Urgency is around 11%, frequency around 6%, incontinence around 5%, and there was a whole list here. I'm just showing you the first few symptoms, but you can see that the prevalence of nocturia, nighttime urination, dominates all other symptoms in lower urinary tract issues in men. If you look at the age groups, so this is 30 to 39, 40 to 49, 50 to 59, and over 60. This is the prevalence of nocturia, which is greater than 1 void per night. So that prevalence in the younger group is around 10% or 11%. 40s, it's around 23%. 50s, you're looking at, low 30%. Greater, when you hit 60 and over, you're looking at close to 60% of men complain of nocturia. So it's a significant problem. And there's a medical need here. Nocturia is associated with disrupted sleep, poor quality of life, increased falls and fractures, depression, and increased overall mortality. Nocturia actually has related hip fractures. Yeah, think about that. I mean, when you're older, you're in your 70s, you're in your 80s, you're getting up at night, you're tired, you have to go to the bathroom. That's when a lot of falls happen. And that's where you get a lot of fractures. So here we have a number. Nocturia-related hip fractures cost about $1.5 billion. And that was in 2014. That was the last time I saw that data. I mean, that's significant. Conventional LUTS treatments typically fail to reduce nocturia. A lot of the conventional treatments are drugs that may affect hormone production and stuff like that. They're better at handling the frequency issue, the weak stream issue, the intermittent stream issue. But conventional treatments do not do a very good job when it comes to reducing nighttime urination. So our solution was to put together a very special blend of researched proven prostate nutrients that we feel when you put them together are going to have a tremendous impact on nocturia. I'm going to show you that research in a moment. But we have beta-sitosterol or sitosterol. We have pygeum bark, lycopene, boron, and melatonin. So we're putting these blends together to have an effect on nighttime urination. So let's look at each one of these ingredients and the researched proven mechanism of action. So beta-sitosterol inhibits 5-alpha reductase. That's the enzyme that converts testosterone to DHT. So beta-sitosterol lowers DHT, dihydrotestosterone, which is a very potent testosterone that causes a lot of prostate issues, and it also inhibits inflammation. Pygeum bark also inhibits 5-alpha reductase. It modulates bladder contractility, so that's going to help with like the intermittent and weak streams, and it also inhibits inflammation. Lycopene promotes healthy prostate size and structure. It inhibits a powerful cytokine called interleukin-6, which brings down inflammation in the prostate. And lycopene also has been shown to inhibit prostate epithelial cell growth, so keeping that prostate size in check. Boron inhibits the activity of the prostate-specific antigen, PSA. It reduces levels of IGF-1, which is a growth factor in increasing the size of the prostate. Boron also simply reduces overall prostate growth and proliferation. Melatonin, it promotes sleep. That's why we're putting in the formula. But melatonin has also been shown to mediate what is known as the prostate MTI receptor. This is a receptor that helps to relax the urethra that runs through the prostate. That's called the prostatic urethra. And by modulating that receptor, melatonin is not only able to help with sleep, it's able to reduce nocturia. And the studies show that melatonin is able to do this at about 2 milligrams a day. So let's look at some of the clinical studies. This first one was a 60-day open label pilot study. It involved 30 healthy men, average age about 58. All of them had mild LUTs, lower urinary tract symptoms, mild. They were given 1 capsule 1 hour before bedtime daily for 60 days. And again, that capsule is the blend that you see down here. The beta sitosterol, the pygeum, 15 milligrams of lycopene, 10 milligrams of boron, and then the 2 milligrams of melatonin. And so what we were measuring here is the change in the International Prostate Symptom Score. So we want to see this IPSS baseline score of 4.3. We want to see that come down. We're measuring that change. And this was a life extension clinical research study. So here are the results. What we found is a remarkable decrease in nocturia. So again, if you look at the different colors here, green is the number of subjects that pretty much did not have nocturia. Orange is the number of, or percent of subjects, I should say, that would get up once. And red is the percent of subjects that got up 2 to 3 times at night to go to the bathroom. So 36.7% of all the subjects had significant nocturia. By 30 days, there were less in the red group. Less of the men were reporting getting up 2 to 3 times a day. More of them were getting up only once now at 30 days. That's why the percent of 1 time at night went up at 30 days. So these men, the 36.7% at the baseline, were now only going to the restroom at night once. So the orange bar here increased and the red one goes down. But look at 60 days. 0% of the men reported getting up 2 to 3 times. Look what happened to the basically men that do not have nocturia. 77% now reported not getting up at all to go to the bathroom. These are significant reductions in nocturia with this research-proven blend of prostate nutrients plus melatonin. This is something that conventional medicine right now simply can't do. So just to give you where we're sourcing all of these nutrients from, avocados is the main source for the beta sitosterol. The pygeum comes from the African plum tree. Most of you probably know tomato, that supplies the lycopene. The boron comes from volcanic springs. And then, of course, melatonin is natural. It comes from the pineal gland. The melatonin that we use is bioidentical to the melatonin that your body produces. So that is where we're coming up with the nocturia nutrient blend. Listen, this is going to have significant impact on your clients and customers that complain. When those guys come in complaining about getting up at night, going to the bathroom too much, this is a solid blend that we can think about. Now, if they have some of the other complaints, let's say of frequency, maybe urgency, that kind of stuff, but nocturia is not one of their complaints, I would probably go with the standard prostate formula. But for most of them, they're going to have nocturia, and this is the blend that I would put them on to reduce nocturia. All right, let's go into the second section. This is reducing cardiovascular calcium burden. We're going to talk about Vitamers, which are just subtypes of K that work together to balance calcium. The target audience for this blend of vitamin K are people who want to support cardiovascular and arterial and bone health, people who are looking for a broad range of vitamin Ks, and of course, people that are looking for clinically effective doses for heart and bone health. So the problem is cardiovascular and arterial problems continue to be chronic health concerns in aging individuals, right? We know that. Vitamin K is beneficial for keeping arteries clear from calcium. Vitamin K1 is sourced from your greens and vegetable sources, but the bioavailability is a little inconsistent from these sources. And vitamin K2 is primarily found in fermented and high-fat foods like dairy that many people try to avoid. So, yeah, we want to always try to increase our nutrient intake from food, but I also think we just have to understand the limitation of that sometimes. In the case of vitamin K1, we probably don't absorb that much of it from leafy greens. And vitamin K2, a lot of the foods you find it in, people are trying to avoid those. So really it comes down to then supplementation is key here. Supplementation is key when it comes to vitamin K in all the different forms. Again, vitamin K refers, and this is the solution, right? Vitamin K refers to a family of fat-soluble vitamin compounds classified as K1 or K2. K1 are your phyloquinones, K2 are your menaquinones. And when you look at vitamin K2, the menaquinones, they're broken down into 4 basic types. There's MK4, which is the most rapidly absorbed. There's MK7, which lasts the longest in the body. There's MK6, which has the most cardiovascular protection. And then there's MK9, which also has a lot of cardiovascular protection. So so what was it a few years ago? Vitamin K on the market was basically just K1. And then we started recognizing the power of vitamin K2 in helping with calcium balance. So you started to see K2 added to formulas, and it was mostly MK4 or MK7 or a combination of two. But Life Extension is now bringing to the forefront a vitamin K blend that's K1, MK4, MK7, and the cardiovascular menaquinones 6 and 9. We are one of the first companies bringing this to the market. So the science, it's very simple. Vitamin K manages calcium. Some people like to call it calcium balance. So there is a hormone called osteocalcin. Osteocalcin is necessary for helping calcium mineralize bone, and it is vitamin K dependent. And then you also have something called the GLA protein that also helps to bring calcium out of the systemic circulation and into the bone. That is also vitamin K dependent. So in order to move calcium from your digestive system into your bloodstream and then eventually into the storage area, which is your bones, vitamin K is needed to activate osteocalcin and GLA protein. So here was a study. This study measured the progression of aortic valve calcification in vitamin K supplemented subjects. This was 72 men and women with mild to no symptoms of aortic valve calcification. This was a prospective, open-label, randomized interventional trial. They were given 2,000 micrograms of K1 for 12 months. So this was a K1 specific study. It shows you K1 is very important. A lot of people think of K1 as simply for blood clotting. Not true. K1 also has an influence on osteocalcin and GLA protein. The results over the 12-month period, the aortic valve calcification amount or score progressed by 10% in patients in the vitamin K group compared to a 22% increase in the placebo group, representing a significant reduction in calcification progression by vitamin K compared with placebo. That's big. There really isn't anything in the conventional world and in the natural medicine industry that is shown to do this other than vitamin K. So vitamin K was reducing progression of calcification on a very important valve in your heart. This is the study data just laid out in a table. So here you see this is your vitamin K group in the middle. This is your placebo group to the right. You can see at day 1, when the study just started, the average calcium score or volume in milliliters was, and it's called a score, was 793 in the vitamin K group. And by 12 weeks, it reduced down to, it increased to a mean of 871. That was that about 10% increase. If you look at the placebo group, they started out at 836 and increased the 22% to 1,017. The standard average there was 791 and 936. So at the end of the day, your vitamin K group had significantly lower progression in calcification of the aortic valve. Now, this study was looking at K1 and K2. And we were looking at, in this one, coronary calcification. That's something that people look at a lot. What's my calcium score, right? That's what we're looking at, coronary calcification. This was 564 postmenopausal women in a cross-sectional food frequency study to monitor K1 and K2 intake. The average dose through this questionnaire was estimated to be about 40 to 57 micrograms a day of K2 and around 325 of K1 a day. The results showed that the menaquinone intake, that's the vitamin K2, was associated with decreased coronary calcification. Adequate menaquinone intake could therefore be important to prevent cardiovascular disease. So in this study, although K1 does have an influence on calcium balance, K2, at least in this study, K2 dietary intake was shown to be more effective at reducing coronary calcification. Another study, kind of the same setup here. This was investigating the association of vitamin K1 and vitamin K2 with, you can see the different forms there, MK7 through MK9. Remember, MK9 we believe to have a lot of cardiovascular protection. And we were looking at the effect on coronary heart disease. So this was a large population based epidemiology study utilizing a food questionnaire to monitor dietary vitamin K intake. Over 16,000 women were followed for 8 years. The mean vitamin K1 intake was about 212 to about 100 micrograms per day, and the vitamin K2 intake had a range of about 29 or so micrograms a day. So about I know that's a big range there with the K1. It's plus or minus 100 micrograms because it's a questionnaire. You know, that's some of the limitation with the questionnaire. But let's just say 210, 215 micrograms a day for K1, and let's say about 30 for K2. The results showed after adjustment for traditional risk factors and dietary factors, researchers observed an inverse association between vitamin K2, mainly MK7 and MK9, and risk of coronary heart disease. A high intake of these menaquinones could protect against coronary heart disease. You know, simple vitamin supplementation, right? This is what I love. You know, in this case, this was a dietary food intake, but at the end of the day, knowing that we're not sure how much absorption people are getting from food, from K1, for K1 and K2, supplementation is key, and it's simple vitamin K supplementation having a major impact on calcium balance, helping to drive calcium into the bones where it gets stored, keeping it out of the cardiovascular system. So Life Extension is bringing this forward again. It's a blend of K1 and K2 with MK4, MK7, MK6, and MK9. You really don't see 6 and 9 in a formula. We're really the first to bring that into the market, and we're very excited about this comprehensive vitamin K product. All right, the last section, and then we'll open up for questions. Sleeping well without melatonin. Herbs for healthy sleep cycles. Your target audience for this type of herbal blend is obviously individuals looking to support healthy sleep cycles, right? But it's also for individuals who are not comfortable with melatonin and or other ingredients that we've promoted before at Life Extension, like milk peptides. So really, it's for individuals seeking non-melatonin, milk-free, herbal ingredients to support their sleep. So let's take a look. The problem, according to the CDC, 35% of US adults are not getting the recommended 7 hours of sleep each night. That's a lot. I don't know, maybe you fall into that. That's a lot. And what's really interesting is when you really break down how much sleep we're getting, a significant number of these people in this 35% are getting like less than 4 hours. Well, that's crazy. And many sleep aids on the market provide melatonin, and that's, fine. Melatonin, I take it, works for me, doesn't work for everybody. It gives some people weird dreams, and they just don't like it. So our solution was to, how do we help these people? There's, out of that 35% who sleep less than 7 hours a day, there's a significant number of them that don't want melatonin or don't want a milk peptide product. So we put together Hinokio. You might recognize that. That's also used in some of our pain management products. Hinokio, which is a modulator of GABA, that inhibitory neurotransmitter. Lemon balm, right, which keeps GABA around, blocking the conversion to glutamate. And then chamomile, which also enhances sleep, we think, through the GABA mechanism. So we're looking at a solution with herbs mostly targeting GABA and its receptors. So here's a breakdown a little bit more detailed of the mechanism of action. Hinokio enhances the activity of GABA receptors in the brain, which results in a calming, relaxing effect. Now, Hinokio does not necessarily increase GABA levels. Instead, it is an allosteric modulator of GABA A receptors, which means it helps the GABA to connect to the receptors better. And that's where we're getting the calming effect. Lemon balm, I'm sure most of you are familiar with this one, right? This is the active constituent that you find in rosmarinic acid. It boosts levels of GABA by inhibiting an enzyme that breaks it down. There's an enzyme that drives GABA or converts GABA into glutamate, which is your active neurotransmitter. And we get high levels of glutamate. That's not good for the brain. So your body controls that. But as in some people, that conversion of GABA to glutamate accelerates. And so we have less GABA and more active neurotransmitter. Lemon balm inhibits that conversion, keeping GABA around better or longer. And then, of course, chamomile, its active constituent is apigenin. Computer-based evidence suggests that apigenin produces a gene expression signature that is similar to that of an orexin receptor inhibitor. Now, let me explain that. Orexins are compounds that are produced in the hypothalamus of the brain, and the orexins are involved in wakefulness and arousal. And studies are showing that some people with at least severe insomnia, they overproduce orexins. So they have a lot of wakefulness and arousal going on, right? So there are pharmaceutical companies who are in the process of developing for their next prescription sleep aids, orexin receptor inhibitors, decreasing the influence of orexins in people with severe insomnia. So we have found, based on computer models, a natural compound, apigenin, from chamomile, that has the same signature, the same genetic expression signature as these orexin receptor inhibitors. So we believe apigenin is your natural medicine's alternative to what the pharmaceutical companies are trying to develop. Apigenin has sedative effects expressed through GABA receptors as well. So here's the proof of concept for Hinokial, that it actually is involved in GABA receptors. So let me try to explain this. This was a mouse model. Proof of concept studies are often done in animal models. And what you see here on graph A is the transition from the mice being awake to going into non-rapid eye movement. So some of the mice were just the vehicle, the control, and there was very little, or there was a longer, I should say, there was a longer time period that it took for those mice who did not have the Hinokial to go into non-rapid eye movement. The mice given the Hinokial transitioned into sleep, into non-rapid eye movement, in a much faster time period. So the way we phrase this is that Hinokial shortened the sleep latency, the time it took to get into non-rapid eye movement. Hinokial basically was able to get these mice to fall asleep faster. Now, here's where it gets interesting. So that's what we see in A. But you might be thinking, well, how is that proving that it's working through GABA receptors? Here's the second part of the study. So now that we see on the first part, the part labeled A, that Hinokial definitely shortened the time period to fall asleep. Now, in the second half of this study, these mice that were given the Hinokial were also given a GABA receptor inhibitor. That's the flumazenil. Flumazenil binds to the GABA receptor and blocks it, so GABA can't get in. And notice in this part of the study, Hinokial had very little influence on the time it took to fall asleep because it couldn't affect the GABA receptor because there was this strong inhibitor. So when the inhibitor of the GABA receptor was present, Hinokial couldn't work. But when that inhibitor of the GABA receptor was removed, Hinokial significantly shortened the time it took for the mice to fall asleep. That's the proof of concept that Hinokial is working through the GABA receptor. This is really exciting. More and more research is showing that chronic pain, maybe even some of just the general aches and pains of aging and insomnia, fall under what I'm beginning to call a GABA resistance, a GABA receptor resistance. Just like you have insulin resistance with diabetes, it looks like some of these pain conditions and lack of sleep conditions is a GABA resistance. There's something wrong with that receptor. And so to see that there is something here, Hinokial, a natural substance that is able to improve the GABA receptor, and in this mouse study, shorten the time it took to fall asleep. That's exciting, and we are now moving Hinokio into clinical trials, looking at pain and looking at insomnia, because the proof of concept is pretty solid now. Here's a lemon balm clinical study. This was to evaluate the efficacy of lemon balm on stressed volunteers who have mild to moderate anxiety and sleep disorders. This was an open label study, 20 stressed volunteers, 18 to 70 years old. They were given 300 milligrams of lemon balm in the morning before bed. I'm sorry, 300 milligrams in the morning and 300 milligrams before bed. And as much as 95% of the subjects, 19 out of 20, responded to treatment, of which 70% achieved full remission for anxiety and 85% for insomnia and 70% for both. Now, granted, it's a small study. It was in stressed volunteers, which is good. Granted, it was open label. Hey, this is a good hypothesis generating study. Would love to see larger randomized controlled trials with lemon balm. I think we would see some significant findings for insomnia specifically. This is just showing you the lemon balm efficacy data. The first column here is anxiety. The second column is insomnia. So anxiety in 14 of the subjects, which is 70%, had a very much improvement. For 5 of them, it was much improved, which is 25%. And then the insomnia, 17 of them, which is 85%, had a very much improved insomnia. And then much improved, which was 3 of them, was 15%. So this is where we're getting our data from, showing you that when you combine both of this, that 70% of these subjects improved in anxiety and insomnia with lemon balm. The chamomile clinical study, evaluate the effects of chamomile extract on sleep quality in elderly people. I like that. Single blind randomized controlled trial, 60 elderly subjects over the age of 60, given 200 milligrams twice a day versus placebo for 28 days. Simple result. Sleep quality in the treatment group was significantly better than the control group. So right there, chamomile working through that apigenin, right? Most likely blocking the orexins, those compounds from the hypothalamus that involve wakefulness and arousal, blocking those, acting as an orexin inhibitor, had significant improvement in these elderly people who had problems sleeping. So in summary, we're reducing nocturia, the most prevalent symptom that you find in men with lower urinary tract symptoms, with a blend of research-supported nutrients. We're balancing calcium with, right now, the most complete vitamin K you'll find on the market, and we're offering a research-supported herbal blend for improved sleep quality without milk and without melatonin, for those people who just don't want those two things. By the way, lifeextension.com/training is where you can find, is where eventually this webinar will be posted, and you can download the slides there, and you can share those slides with your staff members to train. But also on that page are past webinars that I've done that you can watch and also download those slides. That's lifeextension.com/training. In about 1 hour, you're going to receive an email that will thank you for your interest, and that will send you to a landing page where you can see some of those products. So right now, though, lifeextension.com/training for more education. So let me open up, see if we got any questions. If you have any questions, let me open this up here. So Brent wants to know, is the MK7 in the new formula synthetically produced or naturally sourced? It is naturally sourced, Brent. And we can get you all that information if you reach out to Life Extension, or you can also go through your wholesale rep in your area, and we can get you the certificate of analysis for the product. We had another question earlier before we did the webinar about the Nocturia product, the blend of prostate nutrients, and about if somebody could take that with, like, say, a general prostate support product that they're on. I don't see any problems with that. However, I would really talk to that person and figure out what is their predominant symptom. If you're talking to a guy whose predominant symptom is nocturia, I would try this blend without a prostate formula. I would try this, think of this blend for nocturia as their prostate formula. If nocturia is not one of their big problems, it's frequency, maybe weak stream, stuff like that, urgency, I'd probably just stick with their normal prostate formula. I want to thank everybody for joining me today. Obviously, if you have more questions, you can reach out to Life Extension. You can also talk to your wholesale representative, who we can work through to get any answer that you need. And please check out lifeextension.com/training for the slides and more of these webinars. That page is going to continue to grow with more videos, ebooks, training pamphlets, and of course, webinars. So I'm Dr. Mike. Once again, thank you so much for joining me. By the way, those at the training center, those webinars there are on demand. You can watch them 1,000 times. You can come back a year later and watch them. You can share them. So it's a great way to educate your clients, your customers, and also your staff members. Lifeextension.com/training. Once again, thanks for joining me. Have a great night. We'll see you soon.